Scott. How you doing?
Yeah, good. What's happened?
Oh, my cat's had a really awkward fall.
How far?
It's fallen from about 10, 11 feet.
Right.
From a door.
Wow, that's a huge fall.
Yeah.
Hello, sweetheart. Hello.
What's his name? Hello.
His name's Kintosh.
Kintosh.
That's a hell of a fall for a little man, isn't it? Yeah, he's not walking very well on that leg, is he? It's just hanging. Let's have a little feel, sweetie. Oh, sweetie. Oh, yeah. Bite the vet. That's fair.
Holding little Kintosh, I can see that there's something wrong with his left leg. He's not putting it down properly. And when I extend it, he's very sore. Yeah, Sammy, look, I can feel some real grinding nuts and bolts type feeling in this hip here. So unfortunately, I don't think he's got away with this fall scot-free. So I think what's best is that I take him straight downstairs.
Yes, please.
Give him a quick x-ray and we can talk more.
That would be perfect.
All right.
Thank you so much, Scott.
You grab a seat.
Thank you. Thank you so much for your help.
Come on, sweetheart. Let's go.
I'm extremely worried about him. I just hope he's going to be all right. He's just a kitten. He's still a baby boy.
Hey, Gina.
Hello.
Look at this little kitty. Well, this is Kintosh, who's decided to jump off an 11-foot door.
Why have you gone and done that?
What are you doing?
Assisting Scott today is vet nurse Gina.
This left leg is a problem, so just...
You don't like that, do you?
See how that one goes down and that one?
Yeah, okay.
There's something going on in this hip area, so we're going to have to give him a little sedation and just see what's going on, and hopefully it's nothing too serious. Hey, hopefully it's nothing too serious. Hey. Kittens obviously are very energetic, bouncy little creatures, which is lovely when you're playing with them, but when you need to do something mean, like give them an injection, not so nice. Oh, we're sorry. Oh, baby, all right. So we'll have to keep him a little bit still in order for us to be able to take an x-ray to have a look at his hip and see what needs to be done. X-ray. Oh, dear.
Doesn't sound like very positive noises you're making.
No, for very good reason. Look.
Oh, that's not good.
Poor baby. Hey?
You good? Are you lovely? Oh yeah, you're a good girl. You're a good dog.
In Chiswick, Lisa is bracing herself for a trip to see Scott with her German Shepherd, Poppy.
Let's see Scott now. Come on then. Let's go.
Poppy is just 1 year old, but Lisa is worried about something strange with the young dog's back legs.
Off to the vet, Pops. When we take her out, she bunny hops because it's like her legs don't go together. Come on, he's a good dog. Her legs go stiff. Come on then. Especially when she's resting, like after she's been running. She struggles with her legs. Yeah, I know. You'll be over there, don't you, with them?
Lisa will be devastated if Poppy's problem is serious. The loving dog has brought some much-needed cheer back into her life.
I cared for my mum for 4 years. In that time, my other dog passed away, so we was without a dog for a year. Then my mum passed away. I had so much time on my hands. I missed having a dog in the house. Yeah, she's made us busy, kept us happy. Yeah, she's lovely. I know, you're good.
Lisa is hoping Scott will be able to help the young dog and give her the quality of life she deserves.
To watch her running like she was when she was a puppy, be great. Really, really great. Come then, Pops, we'll go and see Scott.
So, Sammy, here's your boy. All right.
Oh, Kintosh. Hello, boy.
At his Richmond clinic, Scott has just x-rayed tiny kitten Kintosh after his nasty fall.
They made you better, yeah? They're gonna make you better, yeah?
And now he has to tell worried owner Sammy the results.
On this left-hand side, there is a fracture. There's a break.
I can see that.
You've got a ball, you've got a neck, and then you've got the femur, so the thigh bone.
The thigh
and they sit into the socket, and that's the ball and socket joint, which is the hip. So the ball has come off from the neck. So when he's fallen, literally that's just snapped off.
Oh, poor Kintosh.
If you did nothing with Kintosh, eventually this leg will be completely non-functional because the head and the neck would still be grinding and rubbing against each other, causing pain. Kintosh would continuously lift the leg up. The leg would start becoming wasted, the muscles would tighten up, and eventually it would just be a withered leg hanging on the side of this poor cat's body. So what we need to do, unfortunately, is do what's called a salvage procedure. So a procedure which will allow him to continue to function, but he's not going to be perfect. What we'll do is actually go in and remove the ball, the femoral head, and a little bit of the neck as well. So he'll have a free-floating hip joint.
Okay.
Now, in a cat, all the muscles will take on the strength of the joint. And in time, he might have a slightly shorter leg, but you should never see it as an issue.
There won't be no limping or no lameness.
There shouldn't be, no. He should be able to jump and run and do all the normal things that a kitten should. Exactly.
Perfect.
Yeah.
Perfect.
But unfortunately, he does need to go through major surgery.
Unfortunately, yeah. My baby boy would be better.
Yeah.
Perfect.
All right.
Thank you for all your help, Scott.
No worries. You want to say goodbye to your little chap?
Bye, Kintosh. Bye. I didn't actually think it was that bad. To be honest, I thought it was a bruise or maybe a torn ligament. Fracture was completely out of the picture. It's really alarming. I just hope Scott can do a really good job and, you know, fix my baby boy up. Bye, Kintosh. See you soon.
All right, Sam.
All right, then.
See you soon.
Thanks, guys.
Bye.
Bye. I'm extremely worried about him. It's going to be a devastating blow to me and my family if something was to ever happen to Kintosh.
Okay, let's knock this boy out then, shall we? Sweetheart, it's proper sleepy times now.
Scott is about to start surgery on little kitten Kintosh. The 14-week-old kitten snapped his femoral head, or the top of his thigh bone, after falling from a high door.
Poor little Kintosh's hip joint is no longer effective, and I can't even fix it and place a pin or some screws or even a plate. It's far too short. So what I need to do is to actually perform a femoral head and neck ostectomy. That's basically going into the joint, removing the head, the ball of the ball and socket joint, remove any bony attachments to the hip altogether so that he'll now have a free-floating joint. Okay, happy?
Happy.
Right, here we go. So I'm cutting now, okay?
Yeah.
What I need to do with Kintosh is a major operation. Orthopedic procedures always come with risks, and to go fishing into the hip joint of a very young animal, there's the anaesthetic I've got to worry about, and one false move and things can go very wrong. How's our patient doing? All okay?
Patient's good. We got a nice strong heart.
That there looks just, oh dear, doesn't look good, does it?
No.
I was hoping it was going to be much easier, being that it's a little animal that's not particularly well muscled, but actually it's just so tiny. When you can see that's the fracture there, that's where it's broken away. It just requires a little bit of patience to get it out without causing any other damage. It's a shame. In this case, it's better out than in. It's perfectly formed. It has just the fracture through it at the femoral neck, which is a real shame, but of course it has to come out. So what I need to do is now just take a little bit off of this neck. The final part of the procedure is to file down some of the femoral neck, basically to stop there being any bony contact between the thigh bone and the pelvis, and by doing so, give Kintosh a pain-free life. All right, Gina, so I'm just about to close up now. How's our boy doing?
His respirate, heart rate, all normal.
So surgery's all done and I'm pretty happy with the results. We've got the broken ball out of that socket and closed it up. So hopefully this little boy will work out a way to walk on a joint that doesn't exist anymore, and he can use that leg and hopefully be comfortable. Oh, my little man.
Kintosh will sleep off the anaesthetic before heading home tomorrow.
Sweetheart. Good boy. Yeah, fair enough. It's all right. You just rest.
It's a good dog.
Lisa has now arrived at Scott's practice with her German Shepherd Cross, Poppy.
Are you lovely, are you? I was anxious coming here, a bit worried about what was going to happen to her. I can't wait to get her sorted.
Hello, Poppy. Hi, Lisa. How are you?
Hi.
Hello, gorgeous girl. How you doing?
With her legs a bit stiff. I've noticed they're getting worse, yeah.
Oh, sweetheart.
No.
Well, can I have a little look and see you walking? Hey? Can you show me what's happening? Hey? Good girl. Hey? All right, well, Lisa, if you want to just take her for a walk up to the top of the clinic and back, I'll just have a look at her walking. Okay.
That's it, good dog. Come on in. Come on in.
Watching Poppy walk now in the clinic, I can see she's walking up on the left leg, definitely shows signs of discomfort. She's not fully extending the leg when she's walking. She seems to almost be lifting her leg up a little bit. So there's clearly a problem with this dog, and my guess is it's her hips. Good girl. That's it. All right, well,
Definitely a few issues, haven't you? Definitely a few issues. That is not a normal year-old dog's walk, is it?
No.
No, she's walking a little bit like a grandma.
Yeah.
Okay. All right, let's go into the consult room and chat about your legs, shall we? Come on then. In we go. Good girl, Poppy. What we'll do, Lisa, is I'm just going to get it to you to walk her out from the wall, and then if you grab hold of her shoulders, and then what we're going to try and do is just have a feel of those legs. All right?
Okay, you can stick a muzzle on them.
Do you think that we should straight away?
I think you should. I don't know if she would, but just in case.
I would probably bite someone if they pulled at my sore leg as well. So allowing me to put a muzzle on Poppy just means that Lisa's allowed me to protect myself while I'm trying to look after Poppy. Oh, I know.
All right, Pop.
I know. Yeah. Gosh, straight away. Hey, and I haven't even done anything. Gosh, it just shows how painful she is.
Yeah.
You know, you can't be a Jekyll and Hyde like that without a very good reason. I'd love to do more examination with Poppy, but as soon as I even try to extend one of the legs, she gets very upset and stressed. I think what we're going to have to do today, Lisa, is to give her a general anaesthetic, take all that pain away. Then I can have a good examination and an X-ray. What do you think?
That sounds good. Better.
All right then, Lisa. I'll give you a call when she's woken up.
Okay then, brilliant.
All right.
Thank you.
Take care. Bye.
Bye.
It's all right, sweetheart.
Toby, go get it. Go get it.
In Cambridgeshire, sprightly 3-year-old Toby doesn't look like he needs a visit to the vet, but Toby's developed a disturbing habit.
Toby. Well, Toby is our little puppy. He's not a puppy. He'll be 3 in July, and he does have his problems.
Yay, good man.
He'll come outside, he'll have a wee, and then he'll go inside and he'll start licking. And then he'll lick and lick and lick his private bits. I would have thought that once he was neutered,
that would taken care
that
of.
would taken care of the problem, but this has been an ongoing thing. And I kept thinking, maybe he'll stop this, he'll outgrow this, but he's not. Oh, it's terrible, isn't it? We tried the collar. It's very restrictive for him.
Yeah.
I've got the little onesie type thing, and that stops him. But as soon as you take that off, he's right back at it.
Somebody's gonna have to sort you out.
While putting on a brave face, expat American Pamela and her husband Kevin are worried about why Toby is excessively licking his penis.
Once it comes out and it gets stuck, then there is signs of discomfort that he's getting because it is stuck. So from that side of things, the problem needs sorting.
Are you ready to go? It's gonna be a long trip.
Pamela and Kevin have contacted Scott, hoping he can help.
I emailed Scott. It was quite an explicit description because I thought he would need more details.
Hopefully Scott
Can sort him out.
Funny noise. I know, I know, sweet, I know. Oh, see?
In Richmond, Scott and Nurse Jess are doing their best to settle nervous German Shepherd Poppy, so Scott can examine the 1-year-old dog's painful hips.
Good girl. All right, so sleepy time now, okay? Take away all that pain, if it's just for a little while.
As soon as the anaesthetic takes effect, Scott will be able to get a closer look at Poppy's hips.
1, 2, 3, up. Good girl.
To try to work out what's wrong.
Good girl. So I'm just now starting to properly examine Poppy's leg. Now she is deprived of her senses under anaesthetic, and I can see straight away and feel straight away that the musculature around the back legs is actually really wasted. She should have really big, stocky thighs, but she doesn't. And that's not normal, and it just shows that she probably is not putting all the weight on the back legs that she should. Oh, wow.
It's all right.
You can see that even under anaesthetic, this dog is flinching. So we're just going to turn her up a little bit more. All right, Jess, ready? 1, 2, 3. That's it. Nice. Gosh. Oh my goodness. Jess, look at that. Like, that's it. Like, it should be able to come out to here and...
Poor thing. Oh,
Oh, God. Poppy.
just can't imagine how uncomfortable that would be.
I can probably extend it maybe halfway, but you should be able to point it right back. And this dog has really poor flexibility. And when you think that this should be a teenager, they should be incredibly flexible, this dog has got some serious issues.
You certainly don't see this very often in young dogs. It's devastating, really. You know, they've just started their lives. They should be happy and healthy and full of beans. She's just full of pain. God knows what I'm going to see on X-ray. Okay, baby. Ready? 1, 2, 3. Oh, good girl. Good girl. Okay. X-ray. This is really bad.
Looking at the X-rays, I feel for Poppy and equally for Lisa, because the changes there are significant. And the fact they've happened in just 12 months is shocking.
Okay, Lisa, you're gonna have to be brave to see these X-rays.
In Richmond, worried owner Lisa is finding out what's wrong with her beloved Poppy's hips.
Looking at these, it's very clear that Poppy has what's called hip dysplasia and a very severe case of it. It's really sad to see this kind of condition in a dog as young as she is.
This left hip, it is popped out of the hip joint. And that's why that left leg, I couldn't even extend it. Her leg, I could probably only extend maybe sort of 50, 60%. I couldn't get it right back because it's popped out. It is dislocated.
Wow.
So that's that side.
Dog.
And unfortunately, the right side's not much better. Sadly, German Shepherds are a little prone to this disease. It is genetically inherited, and she has absolutely inherited some awful hips.
Poppy's hips are bad, there's no question about that. And at some stage down the line, surgery may be unavoidable. But I first want to try a non-invasive approach. Given the level of Poppy's muscle wastage on those back legs, I think if we can try to build them up with things like physio and hydrotherapy, I think there's a good chance that she'll be able to better support her hips and hopefully reduce her discomfort. Now, it may work, it may not. But in Poppy's case, if we can avoid surgery, I think it's worth a try.
Okay, we can do that.
Yeah.
We can do that.
All right, well, do you want to come in and see her wake
yes,
up?
please. Yes.
Give her some love and
Yeah.
hugs. I know that's what she needs. Yeah, come on then, follow me.
I knew that it was going to be bad, but not that bad. You know, I just want her to be better, out of pain. Yeah. Oh, baby.
Well, it's going to be a long road for you guys. You know, this is just the start. It's going to be weeks and weeks and weeks.
Wow. I think we're up to that.
Good.
Yeah. Hey, Pop.
It's just horrendous to think what Poppy's been through, but she's so lucky that she's got Lisa by her side, and I know that Lisa will do everything she can to get Poppy happy and healthy again.
Oh, where's my little puppy? Here she is. Here she. Lovely thing. Oh, I'll fix your Pop.
Hello. How are you? Come on then.
After surgery to repair Kintosh's fractured hip joint, Nurse Sam wants to see how well the little kitten's leg is moving.
Amy, good boy. Get you some physio.
Scott removed the ball from the head of Kintosh's thigh bone, but with time and gentle exercise, the muscles should take over.
It's really important that we start some physio with him, although at this stage we don't know how well his leg's healing.
Walking well on that leg, aren't you? Let's do it again. Good boy. I know. Don't get cross.
I'm very hopeful that Kintosh will make a speedy recovery and he won't have any lasting effects from the surgery. He's been so brave.
I know it's sore, but we have to do it. Good boy.
Meanwhile, upstairs,
It's a great email, isn't it?
I've never really read anything like that before, Scott working here.
Scott and Kirsty are reading an email about the next patient.
This dog has got some issues I'm hoping to be able to fix.
But he sounds like he's enjoying himself.
Almost too much.
Yeah.
Maltese Terrier Toby has a problem with excessively licking his penis, and his owners are hoping Scott can help.
Hello.
Hello.
You must be Pamela and Kevin. How are you? Good to see you.
Good to see you too,
Thanks
finally.
for coming down and seeing us. Now let's see the man of the hour.
The man of the hour is Toby.
Toby.
Hello, handsome boy. How are you? All right then, come on, Toby. Let's get you in that consult room. Hey, stop making Kirsty blush. Come on. Pamela and Kevin have written me possibly one of the funniest emails I think I've ever read, and I needed to meet them off the back of that, and I need to meet this dog, Toby. He's been a very naughty boy. So let's see the problem. Whoa, hello. Yeah. Does it stay out that far a lot?
Yes, most of the time.
Really? Most of the time it looks like that. How does it come to be out?
He will go outside sometimes, have a wee, come in. Dogs normally lick themselves after they've had a wee.
Yeah.
He just continues.
Right.
And then he'll lick and lick. And if I call him, he'll look up at me like, yeah.
The problem is something called paraphimosis, or in layman's terms, having your lip stick out, is something that we do see in the vet practice quite regularly. But generally, with castration, the testosterone level wanes and these animals are absolutely fine. But in Toby's case, not only has castration not worked, but it's actually got worse. So I wonder if it's that he is a little bit sensitive in that area, and then by licking the area to appease whatever it is that's irritating him, he stumbled across the fact that's a pretty enjoyable pastime, and then he's just taken it to a whole other level.
Yes. Yeah.
I think we need to look at this as a two-pronged treatment.
Right.
The penis is almost a little bit too big for the prepuce, the skin.
Yeah.
So it's almost like the banana's too big for the banana skin.
Right.
And when it pops out, it actually almost tourniquets around the end of his willy.
Yep.
And all the laughter aside, that can actually be dangerous because it can block off the blood supply. It can damage the urethra, which is the tube from the bladder to the outside. So then it can have urinary issues. It can have blocked bladder as a result. So there's a lot of potentially very concerning symptoms. So I need to try and improve its size and shape. And the way that I'll be increasing the aperture where his penis comes out is by just stretching it and opening it up a little bit. Right. I'll also be placing a tack, I think, further up to try and hold, almost if you think of, a sausage in a bun, if you held the bun up, then the sausage will stay in it. And that's what I'm hoping will happen here with Toby.
As far as I'm concerned, Toby's in the perfect hands.
I'm confident Scott's got a grip of the situation.
Yeah, that's it. That's a good one. He's got a grip of it. Yeah, Toby will enjoy that.
I'm going to sort you out first. No, no, no. Oh, no. I don't normally mind a puppy kiss, but for him, a handshake, I think is better.
There you go.
Yeah.
West of London at Scott's Referral Centre, Teresa has arrived with her 7-year-old cat, Lenny.
Hi, Teresa. Hi, Lenny.
Lenny is booked in to see specialist orthopaedic surgeon Michael Hamilton.
Hello, good morning.
Hello.
Nice to meet you. I'm Michael, and this is Lenny.
Lenny.
Follow me. Okay, so what seems to be the problem with Lenny today?
She's got something wrong with her ear.
Okay.
When I got home, she's losing her balance. She actually fell over.
Oh, really?
And she's gone a bit floppy as well. So there's definitely something wrong.
Okay. When you saw her falling over, do you remember what side she fell to?
She was falling over to her left.
To the left-hand side.
Yeah.
All right. Okay.
She was shaking her head and then just collapsing on the ground.
Ah, okay.
To see your cat falling over when they're normally so full of grace, it was one of the worst things I've ever seen. It was that cold dread that you know something's wrong almost with your child.
She's got her head slightly tilted to the side, but presumably it's been worse than that when she was falling over,
She was falling
guess.
over.
Yeah, sure, okay. Well, I'm gonna have a little look down her ear, if she'll let me. Okay, all right.
Oh, baby.
Okay.
Oh.
Well, from that little glimpse that I got, there's a little growth in the bottom of this ear canal. Let's see if I can show it to you. Can you see that down there? It's kind of shiny, glistening pink thing right at the bottom. Okay, there we go, there we go.
What is that?
Okay, so that's almost definitely, that's a thing called a polyp. So a polyp is a little growth, it's not a tumour. A polyp is an inflammatory lump. You tend to see these in cats that have maybe had cat flu as young kittens, and their immune system is kind of overstimulated, and you get this kind of inflammatory tissue starts to turn into a lump. Here is my cartoon diagram of an ear. Okay, so here's the little bit of ear that you can see. Here is what we call the vertical ear canal, okay?
Lenny's polyp is growing from inside the middle ear, in the bony chamber called the bulla.
And this is where we perceive balance. And if you have a little growth which sits in here and presses on there, that's probably why she's been falling over. So that kind of fits. In her world, her little horizon is that way. She thinks the world is that way up. And that will probably get worse if we leave her untreated. The best way to remove the polyp is actually to go into the bulla itself and actually kind of remove it at source, if you like. It can be quite fiddly just because of the size of the thing that we're dealing with, and we just need to be as gentle as we can do just because of the nerves in there. But you've got to do what you've got to do to get it out, because if you leave some behind, it grows back. So if you're keen to go ahead, we'll get you booked in for as soon as we can, and we'll get Lenny sorted out.
She's my baby and I love her, and I don't like to see her not right. So I want to get her fixed.
I'll see you guys soon.
Okay.
Okay. All right. Lovely. See you soon.
Hi, guys.
Hello. Aw, hello.
This is Toby.
Hi, Toby.
In the Richmond clinic, 3-year-old Toby is about to undergo some unusual surgery.
He's got a little bit of an embarrassing problem, haven't you, mate?
Oh, no.
Shall we share with the girls? They're nurses, so they'll understand. That's the problem.
Oh, dear. That's a bit unfortunate. So during the surgery, I'll be doing the anaesthetic and just making sure that everything's okay. Mainly the top end, whilst he deals with the bottom end.
Okay, sleepy time, sweetheart. Once Toby's under anaesthetic, I can really understand what's going on with his male parts. It looks even more prominent on his side there, doesn't it? One really painful finding is the hairs growing on the end of the prepuce are actually folded inward, and that's one of the major reasons why he can't retract his penis, because it just grinds to a halt. As it sticks to the hairs, the penis dries out and it stays out. We'll do a bit of clipping, okay, or in his case, he needs a bit of a good old manscape. So we're gonna clip all this hair away as much as we can. And one thing you can really see there is just how dry it is at the end.
It looks sore, doesn't it?
It does look sore.
Well, hopefully this will make him more comfortable.
Yeah. Come on, big boy. Let's get you sorted.
Moving Toby into the surgery room and then getting all prepped and ready to go, the first thing I'm going to do is enlarge the opening that the prepuce has to allow for the penis, when it does come out, that the penis can go back into that bag and be nice and comfortable. So that's part one done. You can see now has a much bigger aperture, much bigger opening, which will just allow his willy to come out when it's going to. Now what I want to do is just place the stay suture up higher. And what I'm hoping that's going to do is stop when it retracts, it can flick back in where it should in its little sleeping bag. So you can see that, Gina? So it's now sitting up much higher. All right, there you go, there's his new designer penis.
Well done, Scott.
All right, so you can wake up. I feel that I have made sure that in future, even if Toby keeps up with this, well, a little bit of a naughty, mischievous habit, that at least his penis can return to where it should go, which is back in the comfort of the prepuce, and it looks so much nicer as well.
I'll be glad when Toby gets out of here.
Yeah.
Toby's
I heard
owners
him crying
Pamela and
downstairs.
Kevin will be relieved when they hear the surgery is over.
Hey. So here's your little champ. There he is.
Little man. How are you?
So he has done very well. He has a new little designer prepuce down there. So what I'm hoping is that if it does come out, it can go back pretty quickly and pretty easy. Yeah.
Scott also has a solution that should stop Toby from licking himself.
We could also use a little bit of apple spray in the area, and it might just be that he licks it. Generally, they hate the flavour, and hopefully he'll leave it alone.
Yeah.
Yes.
Very pleased. Very pleased. It's my baby, my fur baby. So looking forward to getting him home.
Well, I'm sure he wants to be quite a long distance away from me, so
Yes.
yeah. So hopefully I get to come up and see you guys in Cambridgeshire soon, and just see how he's getting on.
Okay.
Yeah.
That'd be brilliant.
Bye, champ. See you later.
See you later. Say bye-bye.
Okay, bye. He's like, yeah.
Yeah,
See
right.
ya.
Bye.
Bye, guys.
Bye. See you, Christy.
Go on.
Bye.
It's a new day.
Hi, Teresa. Hi, Lenny. How you doing? How's she doing? Are you okay?
I'm quite nervous.
Oh, she'll be fine. We'll take really good care of her.
At Scott's referral centre, it's time for Lenny's ear surgery.
I'm excited that they're going in to help her, but I'm really nervous because I just worry with any surgery there's risk, you know, that she's under anaesthetic. I just want it to go well, and I want it to come back to me, and I want it to be healthy again.
All right, so try not to worry. I know it's difficult, but we'll take good care of her. Yeah, say goodbye.
Bye, baby.
Hey. See you later. All right, Lenny. Come on then, let's go.
See you later.
Take care. Come on then.
I trust Michael, and I know he'll do a really good job, but I love her and I need her back. So I just want it to be over, and I want her to be back home with me.
There we go. It's all right.
Hello, darling.
Specialist surgeon Dr. Michael Hamilton needs to remove a large polyp from Lenny's middle ear.
She's looking at me going, you so-and-so. It's all right, darling. We're going to sort you out. It's fine. Don't worry. The pre-med has landed.
Lenny's surgery is about to get underway. But no one is prepared for what happens next.
Is that the car there? No.
It was a white car, and it was going in that way. Yeah.
That's the one. It's the one with the big hole in the front.
At Scott's referral centre, a car has crashed into the front of the clinic, narrowly missing clients in the waiting room.
Apparently, some lady had kind of come to the junction kind of opposite and had jumped on the accelerator instead of the brake, and it went full speed straight into the building. You know, it could have been pretty bad, wouldn't it? But Kim had it all under control. She's on the phone. I think she already called the paramedics. She's on the phone to the police as well. Everyone was kind of looking pretty calm, actually, so I just kind of left them to it and went back to what I do.
Thankfully, no one was seriously injured. Now, Michael can proceed with Lenny's surgery.
Right. So, I can feel the bulla just here. So we're just going to make a little incision just over the top of there.
Lenny has a large polyp growing deep inside the bulla, or bony sacs that form the middle ear, and it's affecting the 7-year-old cat's balance.
This round, bony thing here is the bulla. We just need to go a little bit further in actually to try and find this polyp now. There's going to be more of that gooby stuff. So we've went through the major part of the bulla, and you can see, if you look in there now, looks like a little set of grapes. That's all polyp. So we're going to try and grab it, gently tease it out. We're going to try and be as gentle as we can do because we know there's lots of little nerves in here. If we can remove it in a oner, the chances of the neurological problems are significantly less. So that's what we're hoping for. We're going to start grabbing stuff now and just gently pulling and see how we get on. So far, so good. I'm just gently kind of grabbing it and pulling it and then re-grabbing it further down. It's kind of a bit like a magician pulling a handkerchief out just piece by piece. Yeah. Come on. This is feeling really, really good, and there it is. I think this is most of what was in the middle ear. So I think the little bit on the left-hand side, it's almost like a little impression cast of the inner chamber, which is quite small. Comes out in pretty much in a one of this one, which is pretty satisfying.
With all of the polyps successfully removed, Lenny shouldn't have any more problems with her balance.
So just going to flush it gently and then we're going to close up. We've done the surgery. It's went really well. We've got a really good kind of satisfying removal of that polyp. Sutured up and, Lenny's going to do great. Feels good.
Lenny will spend the night sleeping off the anaesthetic before owner Teresa can take her home.
I'm looking forward to calling Teresa to let her know that everything's fine.
You're going to feel so much better when you come home from that.
What you doing? What you doing?
After surgery to repair his fractured hip, little kitten Kintosh has made a remarkable recovery and is well enough to go home.
Kintosh is looking so much happier. He's purring away. He seems pretty comfortable, and he's already putting his foot down, which is a great result. Hi, Sammy. How you doing?
Hello, Scott. How you doing?
Kintosh, there's your daddy.
Hello, Kintosh.
Here he is.
Oh, I'm so pleased that he's coming home today. The house ain't been the same without him, and I'm really excited to get him home,
He's been such a brave little boy.
Oh, I missed him.
But now I've done the surgery. All the work is yours, my friend.
Yeah.
So what you're going to need to do is quite a bit of physio. Now it's all down to Sammy. He really needs to encourage Kintosh to use his leg, and the best way to do that is with physio to ensure that Kintosh does use the leg quicker and more effectively in the future. So you just try and stretch. I know. So if you can manage to do it, last one. It will get less and less painful and become more and more easy for you to do. But he's a fairly forgiving boy. It is very upsetting that Kintosh has had to go through this whole process, that he's broken his hip and that he has needed to have this salvage procedure. But there is a silver lining in the fact that being a baby, hopefully he'll forget all the discomfort and the pain. And so hopefully moving forward, he'll leave all that baggage behind him and be a healthy, happy kitten who does run around like a normal cat should.
Thank you very much.
Good on you.
Good
to see you.
Thank you very much for your help.
Bye-bye,
Take care
mate.
now.
See
Bye.
ya. Bye, Kintosh.
Hey, Lenny. How you doing, my friend?
It's also time for Lenny to go home with his relieved owner Teresa.
You know that it's going to be okay, but there's always that chance that just maybe something will go wrong, something unforeseen, and until you get that call, you just don't know.
Hi, Teresa.
Hello.
You can relax. Everything went fine.
Hello, my...
Here she is.
Hello,
Here she is. So she's recovered really, really well.
So pleased, thank you so much.
So yeah, really chuffed with how it went in theatre. We got into the bulla and sure enough there was this little shiny thing, the suspected polyp, and we kind of pulled it and it kind of gently kind of came out in a one. It was really satisfying.
Fantastic.
So yeah, really good. And that's why her neurological signs are probably no worse at all.
She looks fantastic.
No, really, really chuffed with her.
Hello, baby. I'm really pleased. They found what they were looking for. They've got it out and it all went really well. I'm so happy.
There you go, she looks great.
She looks awesome.
She looks really good, yeah. So really pleased.
Fantastic.
Over to you for some TLC.
I love Michael. I adore him. He's saved my Lenny. He's remarkable and he's done an amazing job. I'm really, really happy. Are you feeling better? Are you feeling better? Yes. Yes, you are.
Ready?
And for 1-year-old German Shepherd Poppy, a run in the park is no longer a painful ordeal.
Good girl, Pop.
Scott diagnosed severe hip dysplasia in the young dog and prescribed intense physio and hydrotherapy in the hope of avoiding surgery in the future.
Good girl.
It's still early days, but so far the results are promising.
It has been quite a tough journey, obviously, getting Poppy to do the hydrotherapy. She still goes every other week. We're still taking her. Sit. All right, Buster, sit.
Lisa now has a second rescue dog, Buster, and he's been the perfect playmate.
He's great with her, and she's great with him. They absolutely love each other. Hate being apart.
Hello, Poppy. Hi, Lisa. How are you?
How are you?
Good to see you.
Yeah, good to see you.
You're well.
Yes, I'm good, thanks.
I can't believe it. I've been watching you throwing the ball for this beautiful girl, and you are doing so well. I can't believe how well she's doing. It's amazing.
I don't think she's got pain anymore. I don't think she's... I mean, the way that she runs and jumps around and plays with Buster, yeah, I think she's a lot more comfortable.
Don't know if I'll be able to promise that forever she'll not have surgery, but I think to be able to push it away until she's maybe a little bit older and a little bit happier with vets, so we can do a procedure as big as that. But in the meantime, I think you've performed a miracle, yeah. Lisa. You really have. This is a dog that could barely move without a huge amount of discomfort, and now she's chasing balls. She seems an incredibly happy, transformed dog, and it's all down to the incredibly dedicated Lisa.
Where's that ball? I think don't rule surgery out. Ready? I mean, she might have to have it in the future, but the way she is now and the way she runs around, she seems such a happier dog. Come on, good girl. I'm happy. I'm very happy. Good girl, Pop Pop.
And as for Toby, Scott is keen to see for himself if the little dog's rather embarrassing problem has been sorted.
Hello, Toby.
Hello.
Hello, Pam.
Hello, Scott. How are you?
I'm really well.
Good.
Have you been behaving yourself?
Yeah, he's been a good boy.
Great, let's have a chat. Whoa, hello.
Toby's fascination with a certain part of his anatomy was proving to be a serious medical issue, and Scott was forced to operate.
There you go, this new designer penis.
Well done, Scott.
Well, the first thing I can see is that the hole that his penis could come out of, the prepuce, is a lot bigger, so it's maintained the size, so it should mean that at least it slips back into that covering rather than get stuck out, which was the problem. The second thing was, of course, his behavioural problem, his habit of
licking
the area.
I use the apple bitter spray.
Oh, yeah, I see that here. Yeah. Oh, look, he doesn't even like the look of it now.
No, he doesn't.
It's almost like just getting out the bottles enough to put him off.
It does put him off. Scott was thrilled with Toby's progression here.
A team effort.
It was, definitely. And Toby's now a different dog.
It's very good to see now, though, that he isn't focusing so much on himself, and all that me time is now translated into family time, which is just far healthier, really, isn't it?
Yeah.
Eh? Far nicer for everyone. Hey, yes, share the love, my friend. How's it going? You all right?
He's a little bit nervous of new people still, but...
Yeah, and very noisy baby. Okay. It's very sad, but this poor little girl has come from a puppy farm, which doesn't surprise me because I can see her abdomen is quite baggy. It's clear that this very young dog has had multiple litters, and it's also very much at the hands of someone who's incredibly unscrupulous. It really is a travesty.
It's really sad to see her in such a bad condition, obviously, and she was much skinnier and had a lot less hair when she first came in as well. Luckily for Ethel and her sister and a few other dogs, they found their way to All Dogs Matter to find new homes. it was clear that she was in the worst condition with the mange and being so severely underweight. So she came straight into foster care with me.
Ethel really isn't the picture of health. She's very thin, so she's probably had a very poor diet, but also her skin is really bad. And also it's very patchy where the hair has fallen out as a result of a mange mite infection. Well, it looks like you've got the mites under control, which is great. You can see some new hair growth growing back, but that's not her biggest issue, which I can now hear.
Yes, so when you come closer, exactly, that's the first thing you sort of notice about her is that it's like sort of grunty snort. But she really does struggle, and it sounds awful, even though maybe she doesn't show us that, you know, it is maybe difficult for her.
So at rest, she makes this much noise.
Yeah, her body shakes, and she sort of really seems to be struggling to just breathe normally.
Yeah, well, it's one of the occupational hazards of looking like that when you don't have a nose and you don't have much of a nostril either, do you, sweetie? It means that you can't get enough air in. Can I have a listen to your chest first, Mrs. Thankfully, her heart sounds nice and clear, doesn't it, sweetie? But that's after I take into account all the huge amount of noise that's coming from up here. It's like she's snoring while she's awake, which is clearly not normal. There is a real rise in the popularity of flat-faced dogs. Therefore, a lot of dog-owning public and people that see them on the street go, oh, it's normal for them to make that much noise, and it really isn't. And certainly in Ethel's case, any point when she's at exercise, she's going to struggle to get the amount of oxygen she needs into her system, and that can mean that it can become life-threatening. So basically what I think we're going to need to do is to give her an anaesthetic back at the practice in Richmond, look down the back of her throat and likely find an elongated soft palate.
So it's almost like a blockage, sort of, so she can't fully breathe in or fully breathe.
And every time she does, it sort of
catches,
flaps away, it catches, it goes into the trachea, the windpipe as well, which is one of the reasons why she's making so much noise, and potentially trim that. And alongside that also, you can see how her nostrils are almost little slits. What we need to do is just open them up, and those two procedures together will hopefully increase the amount of oxygen she takes in with each breath and reduce some of the sort of reverberation that you can hear.
It's a lot easier for her.
And make it much easier for her to breathe. Hey, sweetheart.
Well, we're really so lucky that there is a procedure that can help Ethel, because it will make a huge difference to her life, especially when she goes on to a new home where hopefully, you know, she'll have some dog friends to play with. And if she can, you know, run around and act like, you know, a dog should, then it will make all the difference for her life in the long run.
Not only are you a princess living with Rowena, getting consultations in the park, but now you're going to have a nose job as your first veterinary procedure.
Get your nostrils done, lucky girl.
Yes, but all for a very good cause.
Come on, Kev. What's this? Hey, hello? What's that?
In St Margaret's, one of Scott's feline patients, Kevin, isn't enjoying being housebound.
Hey, buddy. We've been under doctor's orders not to let him outside, and he's not very happy about it at all, bless him. He's absolutely desperate to get back out.
Owner Jonathan has been restricting Kevin's visits outside after the lively Tabby had a mysterious accident 2 weeks ago.
We heard a loud bang outside. He came bursting through the kitchen window, came into the living room, really short of breath, and just was completely unwilling to put any weight on his back legs. So it was a little bit traumatic for him and for me, actually. You want to go outside, mate?
Jonathan took Kevin to see Scott, who prescribed anti-inflammatories and rest.
No, it's tough being indoors, mate. He spends the vast majority of every day looking out the window longingly and meowing. Yeah, I think it's going to be good for both of us when he can finally be let outside again. Come on, mate. Don't run away. Come on, mate. We're going to see Scott. In you go. Come on. Good boy.
Jonathan is worried that Kevin's legs still aren't quite right, so he's taking his little mate back to see Scott for a checkup.
Really hoping that he's actually just going to be fine and there won't be much more to do. But it is a little bit nerve-wracking. I've never had to deal with any sort of serious injury in the past, so it is a little bit nerve-wracking. Come on, mate. Off to see Scott.
Hello, ladies.
Hi.
This is Ethel.
Oh, she's really cute.
Wow, she's in pretty terrible condition, isn't she?
Bit of a scabby genetic mess, aren't you, darling?
Back in Richmond, Scott is introducing rescue dog Ethel to nurses Reagan and Sam.
It won't be a surprise to you to know that she's come from the puppy farming trade. She and a few others were rescued.
The 3-year-old pug cross is suffering from severe breathing problems caused by genetic abnormalities.
I can't believe this is still happening, really. And when we know so much about it and people are still putting money into this industry, it's just crazy.
So I'll leave you guys to get you ready for surgery. I'll go get changed, all right?
Cool.
See you in a sec. Ethel, as a case, just really upsets me. Why was she ever bred in the first place? Because the condition that she's suffering with is genetically inherited. She's suffering, so why would you spread that suffering to other puppies? Let's give her the anaesthetic and start having a look down the back of her throat. Because Ethel is a pug-type breed, a brachycephalic or flat-faced dog, she doesn't have much of a nose, and so a lot of the structures that are present at the back of the nose in a longer faced dog are shunted into the back of the throat. And what you can clearly see now that Ethel's on the table is that her soft palate is sort of flapping in the breeze like a curtain in an open window and going right down and into the larynx. That means that every breath she takes, she will sort of swallow that part of her soft palate, and that leads to that incredible noise. So as soon as we tube her, you'll find this noise will go away. And there, the sound of silence. Okay, good girl. So let's get her next door and get started. The procedure I'm about to perform on Ethel is basically the shortening of the soft palate, but also performing a alaroplasty, which is basically widening of the nostrils. So what I need is for you to hold the soft palate out the way. So I'm going to place 2 stay sutures in. You hold these 2 sutures and then you can lean on me for support and I'll then trim the soft palate accordingly.
Cool.
Get you to on either side.
Yep.
Like that, that's it. So there's the soft palate, that's the bit that's going down our little girl's throat, and that's the bit that I need to trim. If you give that quite a bit of tension, you have to put your elbows on my shoulders, it's absolutely fine.
Okay.
There we go. Oof. A bit of disgusting smelling smoke, and that's a very chunky piece of soft palate. What you can see is by removing that flap, you've now got an open airway, because you can see that that is basically like trimming the curtain, so the curtain's not going down the window anymore. The window is nice and open. You're getting lovely airflow. So I'm just going to oversew that. If you just release now, and we'll have a little look.
Wow, that really is such a difference.
Yeah, actually you can see a larynx.
Yeah.
Good, okay, so that's part 1. So now we're going to do something called an alaroplasty, which is changing the shape of the nostrils. In this case, I'm doing that in order to increase the nostril size and therefore get more airflow going into her nostrils, more oxygen, therefore she should be able to breathe quieter and exercise better. See how much that's opened up? Here we go. There is Ethel's new nose.
Ethel's new nose.
And not a bad looking one at that.
It's a lot bigger, isn't it?
Yeah. All right. Let's wake this girl up. Oh, good girl. Good girl. Hello, baby. Hello. Guinness Book of Records for that tongue. Look at that. You can lick your own forehead. Like that's incredible. But listen to you. I
can't hear anything.
Exactly. That's my point. Yeah. What's incredible about this particular procedure is that literally straight after the surgery, you will see, or rather hear, a massive difference. And this dog should hopefully breathe a lot quieter and a lot easier. Have a little nap, start organising that spa treatment. Yeah? Lovely bath for you, I think. Yes, before you head off. Good girl.
Hey, buddy. Off to see Scott.
In St Margaret's, Jonathan and his little mate, 11-month-old Kevin, are arriving to see Scott.
Morning, Jonathan.
Hey, guys. How are you?
Yeah, good. Hello, Kev.
Oh, isn't he cute?
He's a legend, isn't he? So his knee's still causing him some concern?
A little bit. I mean, the limp's gone, but he's a little bit laboured on the back leg, so it'd be interesting to see what you think today, to be honest.
Come on then, let's go.
Cool. I am very worried. Yeah, he doesn't look too great on his back legs. His movement's not the same as it was before, so I'm a little bit nervous as to what Scott might find.
So you say laboured.
Yeah, it just doesn't look the same as what it was prior to the injury. I don't know, I can't quite put my finger on it, but it just doesn't look quite right.
Okay, well, I suppose he's a very young boy, so he should be very fluid in his movements. It should be
Yeah.
effortless for him to jump and run.
It seems like more of a waddle on the back legs.
Right. Previously, when I examined Kevin, it was clear that he'd injured his left leg and his kneecap was popping out very, very easily. You could barely have to touch it for it to pop out. The kneecap normally sits in a groove, and in some cases it's a little bit shallow and it pops out whenever the knee is bent. Good boy. So let me just have a little feel. Oh, yeah, wow. Yeah. Just feel this side as well. Oh, gosh. Ooh, okay. The last time the left leg was popping out.
Right.
And it's still doing the same thing, but the right leg is now doing the same.
Right.
So literally, I'm feeling his knees, goes, pop, pop. It just keeps doing that. It's just without even touching them. And then when he straightens his leg, it flicks back.
Whereas he's stretching a lot, actually.
He's stretching a lot?
Stretching them a lot, yeah. He puts them out back. And
there you go. See, he's learned how to pop them in himself.
Right, okay.
Which is so clever, isn't it?
Yeah.
Cats, eh? Amazing.
Yeah.
Dislocating patella is a congenital condition, which was most likely aggravated when Kevin had his mysterious fall.
Very uncommon in cats. It's more common in dogs that have really bowed legs.
Right.
And the longer that his knees pop out like that, the more rubbing on the cartilage, which is the protective surface of the joints, the more likely he'll then develop arthritis later in life because the cartilage is worn away.
Yeah, okay.
And we don't want that.
No, of course not, yeah.
So we kind of have to act now. It's unfortunate, but I think he's young, he's strong, he's healthy. So I think it's just let's get it done and move forward.
Agreed.
Yeah. It might sound crazy to perform surgery on both knees. Essentially, it's making a relatively active cat disabled for a little while, but it is all in his best interest because it does mean that he'll only have to go through one recovery period. And really, it is just a case of taking one step backwards before moving forwards. Hey, mate.
All right, mate.
What do you think about that? He's like, that sounds awful.
I wouldn't be too excited, personally. I'm pretty nervous, but he's in good hands with Scott, so I'm sure he'll be okay.
Trying to say goodbye to Daddy?
Bye,
Big
mate.
cuddle. Hey.
Oh, be good. Love ya.
Boy.
Find it! Come on! Flora, come on!
In Isleworth, local vicar Ali is braving the cold to exercise her beloved Border Terrier, Flora.
Good girl! Flora's about to have her 4th birthday, and we've had her since she was 9 weeks old. Good girl! Leave it! Leave good girl! She makes us laugh the whole time, and we say, you can't possibly be miserable with Flora around because she just makes us smile and makes us laugh. I don't know, Flora, what are we going to do with you?
But while Flora's an angel around the house, she turns into a little devil whenever she encounters other dogs outside.
She'll take on anything if she's scared of it.
Ali says Flora's once friendly personality changed 2 years ago when her and her husband made the move from Cambridge to Isleworth.
When we moved here, Flora started barking at the windows. And then gradually, when I took her outside, that sort of reaction started to transfer itself onto just about any dog she saw.
Good girl. You don't need to be frightened because there are no other dogs here, sweetie.
Flora's antisocial behaviour is taking its toll on friendly, outgoing Ali.
Something that Flora should be able to enjoy, like going for a walk, is so stressful for both of us. And the number of times that I've come back from a walk almost in tears because she has reacted so badly.
Ali now realises she needs professional help for her little dog and has asked Scott to make a home visit.
I'm hoping that Scott might come for a walk with us and see her react, and that he then may be able to give me some strategies for actually helping her to become more comfortable with other dogs. And I just want Flora to be able to go for a walk without being so overwhelmed by fear of other dogs all the time.
Where's it gone?
Mate, not only have you got to go through 2 knee surgeries, he's got to wear a bright pink bandage.
At the St Margaret's Practice, 11-month-old Kevin is being prepped for major surgery on both his back knees.
So we can just give him his anaesthetic now. You ready?
Nurse Nathan will be assisting Scott with the surgery on the young cat.
Good boy. With this surgery, it's a complicated one, it's a painful one, and it has a long recovery period. And without the surgery, eventually his knees will seize up, he'll be in too much pain, then he'll start getting osteoarthritis, and he'll basically be an old man in a young cat's body.
Nurses Reagan and Alicia are also assisting.
How undignified.
Okay, good job. Right, let's have a little look. So you can just see, so there's his kneecap there. And so you can just see that? It's pretty gross, isn't it?
Yeah, I don't like that. That's horrible.
And this one's actually worse. So you can just see it's out and then pop.
Yeah.
Now that Kevin's under anaesthetic, you can really see the severity of the dislocation of his patella, his kneecap. You just know that this cat is in pain every single step he takes. And then it goes all the way up before it goes clunk.
It's funny because it's a condition you normally see in smaller dogs, isn't it, rather than cats?
Absolutely. Small, bow-legged dogs.
So does he show the classic signs of skipping, or...?
He doesn't. Instead, it's more like a cowboy trying to run in those boots.
Looks more like you dancing.
Yeah, you don't look like me dancing, mate. That is not a good look. You saw me at the Christmas party.
I did, yeah.
Yeah, okay. All right, then. Let's get on with the surgery then, shall we? Today I'm going to be performing a trochleoplasty on Kevin, and that just means the remodelling of the groove that the knee sits in, basically deepening it, and so the knee will stay where it's supposed to and not dislocate. It is quite a complicated surgery, but a rewarding one when you get it right. I'm just taking a section of the important articular cartilage away. I'm going to put that to one side, kind of deepen the groove further, and then I'm going to put it back. This surgery does require a lot of concentration, and you are using quite large, scary, sharp kit. So you do need to make sure that you have your wits about you and you keep working at it until you get the perfect result. So now I've just replaced the wedge back into the groove, and I've got a couple of millimeters of ridge on either side now. So what that's going to do is almost bumper the patella into that groove and keep it there.
Scott is now doing the same procedure on Kevin's other knee.
So there's the trochlear groove. Okay, you can actually see at the top there, it's quite flat indeed. Now I've got the second stifle joint, the knee, open. I can see that it's equally shallow as the first, so it's very clear that this surgery was required on both legs, and I think Kevin in 6 weeks' time will be happy that I've done it all on one day.
It's okay, it's okay, I know.
Kevin will recover overnight at the practice and will hopefully be ready to go home tomorrow.
All right. Oh, I know. Oh, it's tough, isn't it? Okay, buddy. Sleep it off. All right? Good boy. Good boy.
Hi, Scott. Lovely to see you.
And you. I'm looking forward to meet Flora.
Yes, and Flora's looking forward to meeting you, so come on in.
Thank you very much.
In Isleworth, Scott is answering Vicar Ali's SOS about her antisocial dog, Flora.
Positively vicious, isn't she? Hello.
Flora.
Hello, baby. How are you?
While Scott's getting a warm welcome, Flora has been demonstrating a dramatic change of personality around other dogs.
So far, so good. You seem perfectly well balanced and perfectly calm, but I hear that all is not well when she ventures out of the rectory. Is that right?
No, that's right. So when we go outside, she will turn into a lunging, growling, snarling heap.
Ooh. You can hardly imagine it, looking at her now.
It's quite scary.
And when did all that start?
Basically, we lived in a small village of 3,000 people. She was fine with all of the other dogs in the village, apart from one, which was a Rottweiler who didn't like puppies. And each time we met this Rottweiler in the village, she dived for my legs.
Right. Wow, how frightening for you and for her.
It was very frightening, yeah. Not long after we moved here, she started reacting to other dogs because there is a Rottweiler that lives just down the street, a few doors down. Gorgeous, beautiful, gentle dog.
As generally they are.
Yes, but she's Flora's archenemy. And Flora
Have you got a nemesis, have you?
She does have a nemesis, and she goes absolutely berserk when this nemesis goes past.
But interesting already that you say that in her history she had a Rottweiler that she didn't like.
Yes.
That we have an anxious dog and we have an anxious mum.
Yeah.
And that is not a great combination.
No.
Because if she starts feeling nervous about something, you feel the same way. I think it's not healthy for either of you.
No, and I'm aware of that. So it would be great if we could get her to the point where actually she's happy and I'm happy.
Yeah, let's get to work. But first, I need to see you at your worst.
So, Scott, what I've been doing so far is when we go out, I have a yellow lead for her, which says, I need space.
Right.
And
subtle. As is.
I wear a yellow vest, which says, my dog needs space. From my online research, I discovered yellow vests that we can both wear. It was a last resort because I didn't really know how else to communicate to other people, to ask them to keep their dogs away. And some people have been really, really unhelpful.
Yeah, it's tough, isn't it?
Yeah, it's a problem.
But does that lead to Flora having absolutely no social interaction whatsoever?
Yes.
Which isn't healthy either.
No.
Now that I've met and understood what Flora's problems have been in the past and what kind of dog she is inside the house, I do need to unleash the beast. I do need to allow her to go outside to meet other dogs and observe the behaviour. So, Ali, how do you feel whenever you leave the house?
Often, Scott, I feel quite nervous when I'm opening the door because I never know what dog might be going past.
And it doesn't take long before Flora shows her true colours.
Come on, this way. Good girl.
In Isleworth, Scott is witnessing the dramatic personality change in Flora when she encounters other dogs during her daily walks with Anna Ali. Flora becomes particularly agitated whenever she sees big, gentle Rottweiler Grace, who lives just down the road.
You can see that Flora's hackles are raising. She starts to gnash her teeth. She's pulling on the lead. And Ali looks quite stressed and quite nervous as well. So you can really see that this situation is escalating and it is becoming a really aggressive and angry affair.
Dear. So that was quite a violent reaction, wasn't it?
It certainly was, yes.
And is that normal?
Yes, that's pretty much.
So that's your everyday walk in the park life, is that?
Yep.
Wow.
Yep.
Okay. We've got quite a bit to work on, Mrs. That is incredibly antisocial.
It is such a massive shock to see Flora, a very affable, friendly girl, just turn into this aggressive beast. I mean, she's gnashing her teeth like she wants to rip this Rottweiler to shreds. It's just such a shame that she can't control her emotions and fear is leading to aggression. And it's just unpleasant. It's unpleasant for her and unpleasant for Ali.
Lot to take in today. So what we need to do is to work on her anxiety. So I'm going to ask you to come into the practice and we're going to look at a few different things that we can use to try and reduce her anxiety from a medical and behavioural standpoint.
Yep.
First things first, we're going to ditch this because that makes me stressed just looking at it. I don't think it is going to help you or her. I think it's going to make other people more anxious.
Yes.
I need to get you to enjoy this dog again. I need you to drop your shoulders and relax and smile a bit more.
Okay.
And tell yourself it's an enjoyable activity to walk your dog. And I think all you think about is, oh my goodness, what she's going to do today. Who is she going to lunge for today?
Yeah.
I need to go, this is going to be great. It's going to be really positive and happy. Be relaxed, be calm, and transfer that positive energy through the lead.
Through the lead to her. Scott's been really encouraging today. He's given me real hope that actually we can get to the place where Flora and I can enjoy our walks and they can be happy experiences for both of us.
It's a plan.
Yep.
All we can do is onward and upward.
Thank you very much. Thank you.
Hey, good girl.
today, Ethel? Hmm? You doing well?
In Richmond, rescue pug cross Ethel is recovering well from her throat and nose surgery to correct her noisy breathing.
Come on then, let's get you bathed. There's a good girl. Hey? Here you go. Here you go. Give it in.
Oh, you are here. I couldn't hear you.
Nurse Jess and practice manager Maz are now going to give the little rescue dog some much-needed TLC.
Is that nice?
Is it? Oh, thanks.
Ethel's responding really well to all the affection and attention. I think she's really coming round to us all and getting used to a better life compared to what she came from.
You better get used to these, because once you get out and about in the park, bet you're one who's gonna run in the mud. Aren't you? You're gonna find the muddiest puddle. We thought it'd be really nice to give her a little treat, a little bath, smell a bit nicer, make her fresh and beautiful, all ready for her new forever home that she's getting to go to. There we go. Oh, that's all right, see?
It's nice, see?
Upstairs, Ethel's foster carer Rowena has arrived to collect her.
Yeah, I'm so excited to get her home, not only for us, we get to see how she is and, play at home and see how she's doing, but I'm very excited to meet her new potential home and hopefully they'll be taking her soon.
Hello, here she is.
Hello, little one. She's like, who are you? I can barely recognise you with your new face. Oh, I know. Hello.
So she's done so well since the surgery. Not only has it made a massive difference, as you can hear, to her breathing and that she's not making hardly any noise now, which is wonderful, but also transformation in her personality. Like she's really come out of a shell,
really,
just
that's amazing
being with us for such a short period of time, and you're really getting a bit waggier and a bit happier and certainly breathing better. So
that's
emotional
so good to
and
hear.
physical results. So yeah.
Well done, Ethel, and well done all of you.
I really feel today is the start of a new chapter for Ethel. She's had a terrible start in life. It's literally had her puppyhood robbed from her. She hasn't had access to the great outdoors. She hasn't had medical treatment. She hasn't had love. And now we've been able to treat all of those particular issues and work on her shyness and her emotional side. And hopefully now she'll be a happy, healthy, well-adjusted dog that can go off and enjoy life. I couldn't do anything about the tongue, however, because she has a massive tongue and a tiny mouth, so she'll always have her little tongue tip, won't you, sweetie? But hopefully now everything is as good as it can be for her to find a new home.
It's amazing, that's so exciting. I'm sure she's very excited too. Probably don't realise it now.
All right.
You're not going to want to leave.
Bye, Ethel. See you later, Rowena.
Thank you so
care.
much.
Bye.
Thank you, bye-bye.
Bye, girls.
At the St Margaret's Practice, Jonathan is returning to collect his little mate Kevin a day after his double knee operation.
Look forward to seeing Daddy. Yeah, big one.
Massively excited to see him. It's only been a night, but it's felt like forever, yeah.
Hey, how's it going?
Good, thank you.
Who's
How
that?
is he?
Yeah, good. Is that your daddy? Wow.
Yes.
Yeah. He's done so well.
Look at you.
Shall we show Daddy your crazy legs?
Please.
Shall we? Hey. So he's got two leg dressing. He's not that impressed by.
I'm sure he's not. Mate.
So.
Oh, you poor thing.
So he's got two leopard skin bandages on, as you can see, but that's just supporting the knees whilst they're trying to heal.
Okay.
And also because I have a sense with him that he'll just want to get up and go straight away.
He will, yeah.
And we need to kind of keep him a bit calmer and a bit quieter. And
Sure.
the best way to do that is by having dressings which are a little bit cumbersome, which have a benefit to his knees, but also will just kind of keep him that little bit quieter.
Sure, okay.
Hey, mate.
Kevin will need to be housebound for 6 weeks and will also have physiotherapy to help his legs heal.
He's a trooper, yeah, he's quite resilient. It's clear that he's quite resilient, so yeah, I'm sure he'll have no problems in recovering.
Such a good little patient. Yes, you are. It just goes to the resilience of cats. He's just like, well, where's my dad?
Yeah, get me home.
Get me home. Give me some more love. And this is a tip for the future of getting him in a box.
Sure.
Always put a cat in backwards.
Okay.
All right? And then you're about to make it happen. Good boy. That's it.
There he is.
Scott will check on Kevin's progress in 6 weeks.
He's been prescribed a lot of fuss, a lot of rough scratching, so that's exactly what we'll be getting over the next few weeks.
All right, then. See you
Thanks,
later.
Scott. Much
All right.
appreciated.
No worries. All right,
you.
we'll see you very shortly. We'll see how he's getting on. Hey, mate, we'll get those off very soon, I promise. All right, take care, John.
Thank you. Cheers.
See ya. Bye.
Come on then, Flora, we're going to go see Scott. This way. Good girl, Flora.
Morning, Ali.
In Isleworth, Ali and her nervous border terrier Flora have arrived at the practice to check in with Scott.
Is she being a good girl?
She's being a good girl, at home.
Yes.
Not quite so good outside.
The last time I saw Ali and Flora's behaviour, well, it really was quite upsetting and it really was taking a toll on poor Ali. So I've asked them both to come into the practice. We're going to try and work through a few strategies to try and see if we can get them on the right track. What I wanted to do is to go through a few things that would just help to try and just calm her down, because we know she's quite an anxious dog. So one thing is some medication. Now, it's not like an antidepressant, which we can use in dogs. This one just helps us sort of have a nice and calm and relaxed, so that in this period where we are trying to retrain her, recondition her to actually enjoy the company of other dogs, just takes the edge off a little bit. All right?
That sounds really good.
So that's first things first. And the second one is basically like a plug-in that you would use to have a lovely smell in your house. But you won't be able to smell this, but Flora can. And this will sort of pervade into your house. And so Flora, whenever she's home, will feel really relaxed, really calm, very zen. And hopefully, again, that would just reduce any stress levels that she's feeling.
But the main reason Scott has invited Ali and Flora to the practice is for another strategy he's keen to try.
But first things first, it's all about socialising, okay? So today I've got a little visitor.
Oh, okay.
Yes. So I'm going to be introducing her to our boy Branston, who's a really calm, relaxed dog. And hopefully, if all goes well, take them on a walk together. And on one side, you're going to be in the corner, happy, smiley, excited mum with lots of treats ready to go, getting her attention, and we're just going to see what happens.
Okay.
Let's go for it.
I'm slightly nervous because I don't really know how Flora might react, and I'm really aware that this is somebody else's dog, and I don't want Flora to react badly.
Flora, what have I got? What's this?
Lots of positivity, Ali, lots of happiness.
Yes, what have I got? What have I got here?
Branston, Branston,
girl,
sit,
Flora.
sit. Good boy.
Look, I've got treats for you. Good girl.
If you just move a little bit closer to us.
Good girl. Good girl.
We're going to try and do something that I know that you haven't done since you've been in Isleworth, which is to have two dogs off lead together.
Off
Ready?
lead.
Don't look so frightened. Nice and calm. Good girl, Flora.
Good
girl. So you let Flora
Flora.
off the lead. That's it. Branston, come.
Such a good girl.
Oh, good girl.
Good girl,
Oh,
Flora.
wow. It's so exciting. Hello,
Good girl,
everyone.
Flora.
Yeah.
By using the treats with Flora and making her sit and keeping her focused on me, Scott was able to bring Branston in, and Flora completely ignored both of them.
So when's the last time you saw her this close to a dog off lead?
A long time,
Yeah.
8 months.
Wow.
And that ended up in a fight.
Good girl. Oh, she's a good, brave girl. Yes, she is. Well done. It's because she gets fearful. But if we can see off the fear with positivity and food, then we can make things so much better. And this is good. Just to have them in the same room, off the lead, is a massive step forward.
Yes.
So now I think what we'll do is we'll go and enjoy the snowy weather of Isleworth together, shall we?
Let's have a go, yeah. Let's do
Have our first his and hers dog walk.
Excellent, we'll do that, yes.
Come on then, do you want to go for a walk? For Ali, up till now, it's been all about isolation and stepping away from the situation. There we go, good dogs, well done. But me, I'm a positive person, I'm a social person, and that's exactly what I want for Ali and Flora. So hopefully that little bit of positivity sprinkled over the situation will make a big difference.
That's a good girl.
Good dog, Branston. But she likes food, and that's very helpful.
Yes, she does like food.
Yeah.
That's
So-
a good girl.
I know we're sort of bribing our way into this situation, but actually for you to be able to walk this close to another dog is a first for a while, isn't it?
It certainly is. We haven't done this for a long time.
I wouldn't exactly say that Flora is loving Branston's company, but she's tolerating it, and that is a massive step forward for this upset little dog.
Oh, Flora, you're
Hey?
such a clever girl, aren't you?
Good girl, Flora. Well done.
Flora.
Good girl. So
Well
you
done.
can walk near a dog.
Good girl.
Hey?
So with a lot of positive reinforcement and some calming medication, I am really hopeful that things in a few weeks' time should be really improved. Well done, that's excellent.
That's such a good girl,
Really good.
Flora.
At Scott's Richmond Practice, vet nurse Reagan is bringing in one of her own pets for a checkup.
Hello. Hiya. All right. Good, how are you? Good, what have you got in the pillowcase?
And receptionist Kirsty is intrigued.
So this is my corn snake. Okay. His name is Allard. I got him a few months ago and I just brought him in to see Nathan and
that's a good idea.
see what he says and show him off to everyone.
He's really cute. Can I maybe hold him?
Of course you can.
Is that right?
You can put him around your neck. Oh, lovely. Allard is a corn snake. They're quite a common breed of snake to have as a pet. They're very placid.
It's actually quite warm, so I thought it'd be really cold.
My first pet was a leopard gecko when I was 6. So I've always had a thing about reptiles. I think they're fascinating. Ooh. There we go.
Well, that was different anyway.
I'm bringing him in to see Nathan, who does know quite a lot about reptiles and snakes. Right, let's go give Nathan a surprise. Just because I'm slightly concerned that he hasn't eaten in a few weeks, and I just want to make sure that there's nothing wrong with him.
Oh, hiya.
Hey.
Okay. Wasn't expecting that. Something with a pause, but...
Yeah, no, not today. No legs today. Yeah, this is my snake, Allard.
What have you brought Allard in today for?
Well, he hasn't eaten in about 3 weeks. He's very lively in his tank, which I haven't seen him be before. So he's constantly out. He's never under his log. He's always out and about. And I was sort of just wondering if that means something or if he's ill or, I don't know, just a bit worried about
Just a little bit concerned.
Yeah.
Yeah. We're used to animals such as cats and dogs, and when they stop eating, we do worry. But reptiles are very different. Sometimes it can be the heat inside the vivarium. It's not quite hot enough, or it could be that the humidity is wrong. But sometimes it could be as simple as I need to find a friend. Given the time of year it is, I just want to check whether he is just a little bit randy. So this time of year, when it's warmer, it sets off a trigger, which is mating season. And this is what I think Allard's up to. Now, I know we've called him a him.
Yeah.
Have you had this checked out?
No, I haven't. I don't know if the previous owners have.
To confirm whether Allard's lack of appetite is related to an overactive male sex drive, Nathan needs to check that he definitely is a boy.
So the way we sex snakes is to put a probe up there.
Okay.
So what I'll do is I'd ask you to hold Allard for a minute. Unfortunately, I didn't bring my probes with me. So I'm going to use something gentle, but also something that will do the job as well. So I need to go underneath this scale here. The further it goes up the tail means it's a boy. If it doesn't go up quite so far, this is a girl.
So what's the verdict?
It's a boy.
Okay. Good, I'm really glad.
Given the season and now obviously his sex, I think at the moment he is just concentrating on finding a mate.
So yeah, he's just a bit lonely, looking for a girlfriend, which is quite relieving for me to know that there's nothing too serious going on with him.
What I would say is it might take a few months for Allard to calm down.
Okay.
Weigh him, make sure that he's not losing any weight.
Okay.
But I'm not too concerned at the moment.
It's great to have someone like Nathan in the practice that is so knowledgeable on reptiles, so I can just kind of ask him whenever I need to if I've got any problems, and he's always got the answers. Well, thanks, Nathan.
That's okay.
He wants a girlfriend.
He wants a girlfriend.
Sorry, Allard. We can't sign you up to Tinder just yet.
It's 6 weeks since young cat Kevin had surgery on both hind knees, and Scott has arrived to check on his progress.
Hey, Jonathan, how are you?
How are you?
Yeah,
Nice to see
good.
you.
Really looking forward to seeing Kevin.
Come on in.
Thanks very much. Cheers. Here's the boy. Hello, Kev. How are you, mate? And Jonathan, very impressed. You've been very good.
Following
Keeping him
doctor's
in his
orders.
crate. Following doctor's orders. Good to see. Hello, champ. And you're raring to go, aren't you?
Yeah.
Good boy. Hello, mate. Wow. Oh, lovely big stretch. Yes.
Hey. I mean, he still looks bizarre.
Yeah.
But walking really nicely, isn't he? Yeah. I mean, how do you feel he's been getting on?
It feels like nothing ever happened to him, to be honest. To look at him now, it doesn't look like there's any sort of adverse effects of it at all.
Let's have a little look at you. Can I have a little look? Good boy. Good boy. Let's have a feel. Okay, so that knee is sitting exactly where it's supposed to. What I can pick up now is that just basically the kneecaps are staying in the groove. Before, they were just popping in and out with the bands, and every time you bent his knee, it would pop out and then it would go back in when it was straight. But now they seem to be sitting in nicely, much more stability and hopefully much more comfort as a result. So
good.
I think what's shown today is that actually Kevin's done incredibly well. He's responded beautifully to the surgery. The knees feel great, but right now, I'm just glad to see that these two are still happy and comfortable and still great mates. Yes, he's obviously frustrated. He's normally the man about town, and at the moment he's a cat in a cage.
Yeah, best thing for him though, right?
Absolutely. But just to see him walking so comfortably and just getting around the flat again, and hopefully going to mean that his future's bright and he'll be marauding the roads around here for some time in the future.
Good.
Scott is also checking up on antisocial dog Flora, who belongs to the local vicar.
Well, hello there, Ali. How are you?
Hi, Scott. I'm fine.
Great to see you. You look very relaxed.
Thank you.
Even better, how relaxed and calm are you? With dogs just there. Look. What a leap you've made since I last saw you.
Yeah, she is working hard and I'm working hard too. And I think maybe one big difference is that I'm making much more of a conscious effort to be more relaxed when I'm out with her.
And it shows. I'd say that she's staring lovingly at Big Al, but she's staring lovingly at the pocket of your friend with the treats in it.
Who's sitting? Al sit?
I think that's probably the case, yes.
Yeah. But hey, we'll take it because
We will.
eventually just being around other dogs and being calm will pay off. It might be that she goes, you know what, Big Al and treats in equal measure I quite like.
Yeah, indeed.
Look forward to that day.
Yeah, it's very impressive. So here's your treat. Now, you're going to let me give Big Al a treat. Good
Oh,
boy,
wow.
Big Al.
Very good sharing,
girl,
Flora. What a transformation, hey?
Indeed, yes, it is.
Actually enjoying the reason why you got a dog in the first place.
Yes.
Is to be social and to be outdoors.
Yes, indeed.
Now that I've seen Flora in action and she's doing so well, as is the very calm and assured Ali, I think the ultimate test is exposing her to the lovely Grace. See what happens.
Grace is a local Rottweiler, and Flora has always reacted violently to the big, gentle dog.
I don't expect her and Grace to be best pals. I just want you to be able to walk down your street with Grace in the other direction and her not kicking off. That's
Okay.
all I want.
Great.
Let's give it a go.
Let's give it a go. I feel a little bit nervous and anxious, but I'm happy to give it a go. Come on then.
Good girl.
Come on
That's
then.
it.
Good
So when we see
girl.
Grace, we can just
on
get her
then.
attention. Good girl, Flora. I
sit.
know. And then sit. Good girl. She's not perfect, but you know what? This is just a few weeks.
Yeah.
A massive seismic shift from
It
what
is,
it was
definitely.
before. Because what Flora did then was she clocked Grace. She went, oh, there's Grace. Let's go and tell her off. And then immediately goes, I'd rather have treats than be a bit aggro.
Yeah.
And that's such a win.
Good.
Such a win. So
Oh.
well done.
Well, thank you.
Amazing.
That's brilliant.
Oh, it's been a pleasure. I'm so proud of Ali and Flora. This duo were quite fearful and antisocial in a lot of ways, and now they're joyful, they're outdoors again, and just enjoying the company of each other and of other dogs. And I just think it's been an incredible journey and a great result. Well, after that, I think we need to celebrate. So let's go for another leisurely walk to the pub.
That sounds like a good idea.
Come on.
Come on, sweetie.
Good girl. Well done.
girl.